A 10-year-old child is brought into the emergency department with vomiting and unresponsiveness. What could the cause be? Their heart rate is fast with abnormal rhythm, their blood pressure is very low, and their temperature is also very low. What would you do? Clinical examination shows dilated but reactive pupils, no signs of sepsis, and normal heart sounds. Anything else you'd like to know? The child had recently had a fight with her mum. Her mum is on medication for chronic pain and she keeps her medications in her handbag. Her mum checks her handbag and realises that 10 of her amitriptyline tablets are missing. You diagnose amitriptyline overdose, give appropriate treatment, and the child is transferred to PICU. Learning points. Amitriptyline is very toxic in overdose. If an intoxication or overdose is suspected, always remember to ask parents specifically about access to these medications, as one pill can kill. Amitriptyline overdose presents with features of dry mouth, reduced GCS, hypotension, hypothermia, increased reflexes, convulsive seizures, and cardiac rhythm problems. Their pupils are typically dilated. Widened QRS complexes on an ECG suggest significant toxicity and is associated with increased risk of seizures and arrhythmias. Always perform an ECG in patients with suspected overdose. Normally, ventricular tachycardia with significant shock is treated with DC cardioversion. Remember, this starts at 1 joule per kilogram rather than 4 joules per kilogram, which is the cardiac arrest energy, and it must be synchronized if the child still has cardiac output. In amitriptyline overdose, DC cardioversion is unlikely to be successful. The treatment here is with sodium bicarbonate boluses, aiming then for a higher than normal pH of 7.5 to 7.55. Take care not to push the sodium levels too high with this treatment, however, and monitor with venous blood gases. Intubation and ventilation are important for severe overdoses, both to maintain the airway in coma and also to increase the pH through hyperventilation. Catheterization may also be required, as urinary retention is commonly a feature. Well done to all the doctors and nurses on Antrim Children's Ward who managed this emergency really well. Please follow the Peds Live channels for more educational videos and learning points from our paediatric sims.